people were just hanging on by their fingernails. So I think it's hard to describe what it's like because it was so intense. I started the work because I was the person who was seeing students in the health service who came in with medical issues that were connected to psychological problems. And I started seeing a bunch of gay men who were very, very worried about HIV. And we knew nothing, and there wasn't very much to know. And we started reading everything we could possibly read about it. '85 was a time of a lot of panic around HIV. And at that time, there was still a lot of stigma on the level of, you can infect me through casual contact. When we started GHAP, the first project that we really worked on was going into dormitories and talking about how HIV was transmitted. People in the dormitories would ask questions about, well, what if my roommate has it? What if, I can get it from a drinking fountain? In the first group of people who were tested, one of the people who tested positive was Paul. So it immediately became very personal to him, to me. He was my best friend. I mean, it was a death sentence. And people were fighting against time. There were undergraduates who died. There were graduate students who died. For a long time, for almost 10 years, it didn't seem like there was any hope that things would change. So we wanted to have an attitude towards people dealing with it that wasn't just simplistic and reductionistic, especially because the students we've dealt with at Columbia are very sophisticated intellectually. So we tried to set up a way of talking with people that really took into account who they were, what their past experiences had been, what the illness meant to them. And I think that that's something that's continued.
I think that definitely has continued. I think that the specter of HIV and what it means is completely different. But the legacy of having very individualized pre-test counseling sessions that are open-ended and being kind of dynamically informed is definitely the way that you have something to.
The other side of the way things were at that time is that there was a kind of tremendous solidarity and feeling of fellowship among people who were working in this cause, and that's something so inspiring and special, and that's the thing I don't know how to put into words, that it was possible to be simultaneously very sad and going to funerals and waiting for people to die, and at the same time completely invested in this kind of fellowship that you felt with other people who were doing the same work or facing the same situations.